do you see PGs, postgraduates resigning from their courses and going out of the college due to the unfavorable environment there? What do you how do you see that, sir?
Uh, this is very unfortunate if someone leave his post graduation in between the course. Like, it is very unfortunate. Whatever the branch is, whatever it is, non-clinical, paraclinical. At this age, I am around 15 to 16 years postgraduate, and I can say that anatomy is as important as medicine. Physiology is as important as medicine. Yes, I agree with the point that no one in this world do medical profession to become an anatomist, to become a physiologist. I agree with that, but it is the duty of the our senior members, our say course organizers, to tell them what is their future prospects, what is good there in all branches, what is the good part of that. Everyone is doing their part and everyone is very important. At this point, say Venkatesh, I can say that every branch has their, it is so beautiful branches. The pathologists are doing so much very good work. Microbiologists are doing. You yourself, there is in a community medicine. At 20 years back, it was considered that community medicine kaun lega. But now it is a hot cake. People know what is the good in thing. So this is the responsibility of the HODs or senior persons to show the new people coming in, newcomers, to show the good effect, good things in their profession, in their branches, कि ये इसमें good है. और अगर if somebody is leaving for the because of the work stress, so again, see, this again is the part of the senior professors, HODs, or faculty members to see that which post, everyone, as the madam has said, everyone has different stress level to deal with them. So to recognize them, to recognize that who can deal with this much of work, we have to promote them. Yes, you have to do it. Sometimes it can happen that you have to you can have sleepless nights. You have to wake up for the patient. There are, आजकल तो नहीं होता है, लेकिन हमारे टाइम में हम लोग, we used to do embu for a snake bite patient because we know that that patient can come out next day. That smile is never forgettable. That is the beauty of medicine. When the one patient, when you treat a patient and he will go say bye when he was going, then you feel very good. That essence cannot go. So I don't think that pathologist or microbiologist should be so much underconfident or so much sad that nobody say thanks to me. So somebody who is giving thanks to me, to a physician, to a surgeon, he is giving thanks to all the departments. So we have to encourage this, and we do this. We give thanks to all the branches. So it is important to recognize the good part of every branch. If somebody is there in the stress, even in the clinical, any branch, it is the duty. Definitely, it is the duty of the faculty members to recognize it, that person is in stress, and then give him some tips to handle with it. Organize some CMEs, organize some cultural activities, organize some extracurricular activities, go for the dinner, do some say cricket match, whatever the things we can do to rejuvenate that person. We should know that what were the good things in that PG. He used to make good drawings. Let appreciate it someday. Let appreciate it that you make so much of good drawings. If somebody takes good histories, tell them that yes, you make good. You used to give the good histories. So you have to appreciate them. You have to give appreciation. You have to give the reward them when they do good. They are just like our kids. So we have to treat them like this. I don't think so. If we take care of that, they will even will somebody will leave the course. No.
Thank you, sir. Thanks for the elaborate answer.